Health Tips, brought to you by St. Joseph's Hospital.
Good morning and welcome to Health Tips, St. Joseph's monthly wellness information program. I'm your host, Denis Sweeney. We may feel 100% healthy 1 minute, but with the snap of a finger, we may need to go to the emergency department. Joining me today to talk about what you should expect when you need to utilize the services of an emergency department is Dr. Steve Okhravi, an emergency department physician here at St. Joseph's Hospital. Welcome, Dr. Okhravi.
Thank you.
Dr. Okhravi, when should a person go to an emergency department seeking medical treatment?
This is your definition of emergency. If you think you need acute emergency medical care, you should come to the emergency department. And that is defined by Congress, allowing you to define that state of emergency.
Now, many people may be hesitant about calling an ambulance for help. When is it appropriate to contact an ambulance?
When your medical condition does not allow you to drive yourself, or you do not have anybody to drive you, you should call an ambulance.
Now, during a medical crisis, individuals may not have the time to gather together all of their necessary healthcare documents. What information should people carry with them at all times?
If you can, bring your medication list and a list of your past medical history. But that's not necessary. Try to come into the emergency room as soon as possible.
How long can a person expect to remain in the emergency department for treatment?
And the average is about 2 hours. So sometimes, depending on your medical condition, it may take a little bit longer, sometimes less, but an average is 2 hours.
Now, what are some of the steps St. Joseph's Emergency Department is currently using to reduce a person's wait time?
We have looked at the whole process, what it takes to create efficiency. One of the things we have done is when the patient comes in, they should be brought back to the treatment area. So what we did, the registration part that we did before, we brought it back to the bedside. So the patient immediately when they come in, they see the triage and they could come back to the treatment area. That has saved us at least 20 minutes because we are trying to make this a patient-centric emergency department. So the other thing we have done, we have our providers are seeing the patient immediately, and we have a benchmark within 30 minutes of the arrival. They should be seen by a provider. And we have done a process where the disposition is made quickly because of a constant reevaluation of the patient treatment. And we will try to make that disposition within 2 hours, whether you go home or you get admitted to the hospital.
Thank you very much, Dr. Okhravi. I've been talking with Dr. Steve Okhravi. I'm your host, Denis Sweeney. Please be sure to join us again next month at the same time for our next edition of Health Tips. Until then, have a happy and healthy month.
Health Tips, brought to you by St. Joseph's Hospital.